This portion of UW 360 is presented by UW Medicine Neurosciences Institute.
15 to 30 million people in the United States suffer from chronic headaches.
I can remember having migraines since I was about 15 years old.
People with chronic headaches have more than 15 every month.
I was experiencing migraine headaches nearly every day.
The headaches were painful and debilitating.
If I were to put them on a scale of 1 to 10, the daily headaches were probably on maybe a 6, and then sometimes they would get up to an 8 or a 9.
Michael Simonson says he was unable to work more than 1 day a week when he sought treatment at UW Medicine Neurosciences Institute's headache clinic.
So you've started using the Cephalene?
Dr. Natalia Murinova is its director.
We're seeing incredible epidemic of young people, and most of the headaches affect women in their productive years, starting being 14 or 15, but we're seeing number of young men as well.
That is
Dr. Murinova and nurse practitioner Melissa Schorn team up to provide shared visits at the UW Medicine Roosevelt Clinic.
Maybe there's a certain vitamin or something that I'm missing.
It's an innovative way for several patients to receive care at the same time.
It's nice for patients to be able to share their own story and what's worked for them or what's not worked for them. And it's a shared experience for our patients.
They learn about what causes headaches.
Yeah, there's some medical founding for that advice.
It turns out that Michael's were caused by overuse of over-the-counter headache medicine.
It actually turns out that over-the-counter medication, if you have more than 4 headache days per month, is your worst option because that actually leads to more headaches. So actually one of the first things that we start after establishing your diagnosis is figuring out alternatives to the over-the-counter medications that you have been taking.
Michael has given up the over-the-counter medication. Instead, Dr. Murinova has prescribed preventative medication and has suggested non-medication options.
He's more than 99% improved. How he achieved that was a combination of daily preventive medication along with changes in diet. We have a nutrition shared visit along with daily exercise, along with using melatonin for his sleep. But if they're willing to work hard, and our patients are willing to work hard, they achieve enormous success, and we're very proud of them.
My advice to people that are experiencing migraines is to seek treatment far earlier than I did. I suffered through migraines for more than half of my life, and needlessly.
What I like about my work is getting people not only out of pain, but back to their lives.
Because I've had such a positive outcome, I want to share that with other people. I want to let them know it's possible.